Is your dog or cat with cancer or a serious condition showing a difficult mixed hind leg weakness and overall deficiency, but also intense restlessness, anxiety, rapid breathing, and hypersensitivity to touch? Maybe imaging suggests an abdominal mass or a high suspension of tumor, and bleeding risk is also a concern. It can feel overwhelming, and you may be wondering what supportive options exist to help your pet suffer less and stay more stable. Today's topic is a classic formula that is often brought into discussion in certain cancer and critical care presentations. chaihu加龙骨 muli Tang. It can be understood as a strengthened version of the 小柴胡汤 approach, used when on top of the blocked pathway or poor coordination foundation. There are clearer signs of upper body heat, pronounced agitation or anxiety, and difficulty settling overall. First, the most important boundary for any tumor or critical illness. Step 1 is always proper conventional veterinary diagnosis and treatment. Everything discussed here is only a pattern-matched supportive management concept, and it does not replace imaging, pathology, surgery, chemotherapy, or other standard care when indicated. To keep this aligned with the series, here's the unified location mnemonic again. Today's content complemented. 血府逐瘀汤 addresses chest certain stasis. 膈下逐瘀汤 addresses upper abdomen and rib sides stasis. 少腹逐瘀汤 addresses lower abdomen or pelvic stasis. And 小柴胡汤 supports the whole body triple burner foundation. Stasis formulas focus more on local bottlenecks. 小柴胡汤 focuses more on whole body condition. 柴胡加龙骨 muli Tang is often viewed as building on that foundation with a stronger emphasis on clearing, settling, and calming when the presentation is hotter and more agitated. A common question is this just 小柴胡汤 with 2 calming herbs added? Not really. More accurately, it keeps the core framework of harmonizing 少阳 and supporting triple burner flow, while its structure shifts toward settling and stabilizing the system. In traditional terms, longgu and muli are used for a heavier settling direction. Herbs like 桂枝 and茯苓support circulation and movement. Together, the overall orientation becomes more move clear, settle calm when the pattern truly matches. So what problem is it discussed for, and when might it be considered rather than staying with 小柴胡汤 alone? Focus on 2 signals: stronger heat signs and more obvious agitation or anxiety. In dogs and cats, that can look like, on top of declining strength and poor coordination, the upper body feels more upward and unsettled, panting or rapid breathing, irritability, being hard to touch, easily startled, while the lower body looks weaker, hind leg weakness, wobbliness, urinary control changes. If this is also accompanied by a middle bottleneck picture, abdominal fullness, discomfort, or nerve masses around the liver spleen region, then this formula may be more likely to enter a professional pattern-based discussion. In clinical discussions, high bleeding risk vascular or origin tumors, for example, splenic or cardiac hemangiosarcoma, may also be considered within this category when the same agitation and heat features are prominent. Under professional pattern differentiation, some clinicians may adjust the approach based on bleeding risk management and recovery support. sometimes discussing additions such as danggui or sanqi. However, these are never templates for home use. Species, weight, constitution, clotting status, and medication history must all be assessed by a licensed veterinary professional. In addition, some nasal tumors with strong inflammatory obstruction, lymphoma-related presentations with clear heat and agitation, or other concern cases showing heat plus agitation plus upward disturbance on top of a triple burner foundation issue may also be brought into discussion when the pattern matches. For pet parents at home, here are 3 communication clues that can help you describe what you are seeing. These are not self-diagnoses. 1. More excess above, more weakness below, panting or rapid breathing, restlessness, anxiety, touch sensitivity, plus hind leg weakness, wobbliness, or urinary control changes. 2. Clearer heat signs, recurrent low-grade fever, increased thirst, poor sleep, or inability to settle, sometimes along with constipation or difficulty passing stool. 3. A middle feels blocked, abdominal bloating or discomfort, or known masses or lesions in the abdomen, especially when paired with the signs above. These are only communication clues. The final decision must come from a qualified TCM vet combined with exam finding and test results. Now, the safety boundaries. Please take these seriously. Do not self-prescribe herbs for dogs or cats. Cats and dogs metabolize many ingredients very differently, and if a formula includes herbs that are more cooling or that tend to promote bowel movement, timing and dosing become even more sensitive and must be professionally customized. This approach must be pattern-matched and cannot replace pathology-based diagnosis, surgery, chemotherapy, or other standard oncology care. Pregnancy, chronic diarrhea, abnormal clotting, use of anticoagulant or antiplatelet medications, or any situation where your vet is concerned about bleeding risk all require extra caution. Do not attempt this on your own. If you see sudden collapse or weakness, very pale gums, a rapidly enlarging abdomen, or rapid breathing, treat it as an emergency and go to ER immediately. To close the loop, chaihu加longgu muli Tang is discussed in some canine and feline cancer or critical care management because it aims at the complex picture of a triple burner foundation, a bottleneck plus stronger heat signs, stronger agitation, and difficulty settling. When bleeding risk is high and agitation or heat features are also prominent, it may be considered under professional pattern differentiately. The core rule never changes. Confirm the diagnosis first, match the pattern second, and let qualified professionals set the plan. Never self-medicate. If you're looking for a broader long-term TCM support approach for tumor management, you can also read more about TCMVET by Tu Xiao.